Well, hey, everybody. Welcome to this week's episode of I Don't Care with me, Dr. Kevin Stevenson. Thanks for joining me as always. And you're going to be really interested in the topic for this week because it's something that I've never explored in my almost 7 years of doing I Don't Care. It's food as medicine. And so this is going to be really interesting. I like food, not so fond of medicine, have to take a lot of it. So maybe they can talk me out of medicine and by eating better. I don't know, but we'll see. So my guests today are Adam Devito. He is the founder of Monj, like play on French word, very good. And Maggie Biscarr, who's a food as medicine subject matter expert. Adam and Maggie, welcome to I Don't Care.
Yeah, thanks for having us, Kevin. Appreciate it. Great to see you, Maggie.
Great to see you too, Adam. And we're like on opposite coasts. So what a cool thing to be able to come together in your podcast room, Kevin.
Right. And I'm dead center of the country here in Waco, Texas. And so we've got 3 of the 4 time zones covered. This is great. And I've already coveted Adam's view from his office window. So we won't go into that any further. But hey, let's get started here. Maggie, you've been in the food space for many, many years. Tell us a little bit about you and how you came to focus on food as medicine.
Sure thing. And I'll just say that, like you, I'm a huge fan of food. So when I had the opportunity to work in this space, it was a personal and professional merging of worlds. So I have my background in social work. I have my master's in social work. So I spent the first half of my career really focused on building and launching programs to, just address the social drivers of health for the most vulnerable segments of our population. And about, I don't know, 5 years in, I had the opportunity to work on SNAP enrollment and public benefits access and ultimately food security. And that really was where I decided to hang my hat. And so through my work at AARP Foundation, where I spent quite a few years, I was really fortunate to be able to kind of manage our food security partnerships. And I had the opportunity to develop and launch one of the very first large-scale SNAP nutrition incentive programs. They're now known as GUSNIP, but at the time they were the Food Insecurity Nutrition Incentive Program. And that was with funding from USDA. And they required, it was really a large-scale demonstration project. And so AARP partnered with United Healthcare, and I said, hey, why don't we get United Healthcare to match the funding, and let's launch it with Kroger. And I had the real privilege to partner with some of the OGs of the food as medicine movement, the founder of Wholesome Wave and the founder of Fair Food Network. So Gus Schumacher, for whom the GusNet program is named, was one of my partners. And I launched that in Tennessee and Mississippi with their departments of health and human services and agriculture, and Vanderbilt University was our evaluation partner. So it was really a huge public-private partnership and one of the very early tests of the fruit and vegetable incentive program on a large scale, and has continued to today, and really is kind of one of the most commonly understood types of food as medicine intervention. So that experience inspired me to want to figure out what would motivate the healthcare and or food systems to do more, to lean in more. I wanted to understand the wiring and the incentives that were built into those systems. And I had amazing opportunity to jump over to PepsiCo, where I spent almost 7 years testing and learning with our retail customers like Walmart and the Ahold Delhaize banners, and really to take, supporting these corporate objectives with retail customers and developing programs that were consumer facing to nudge consumers towards healthier products or sustainability behaviors. So that that experience was amazing because I really learned the food system and the retail system inside and out. And then coming out of there today, I sit really at the intersection of food, health, and workforce well-being, and am, am am a consultant and subject matter expert and strategic advisor for multiple companies and organizations, including Monj, and a handful of others, including the Health Enhancement Research Organization, which is it's an association for employers and really focuses on employee and workforce well-being. So, I'm finding myself with all my worlds coming together, and I think that the opportunities today for strategic partnerships across these sectors are amazing. And meeting Adam and having this opportunity to really kind of innovate together has been really fantastic.
Well, that's great. That just sounds fascinating. So, Adam, you've got a long-standing career as a chef and innovation leader with a deep understanding of the food industry. Tell my audience a little bit about you and how you got here and how Monj started.
Sure, I'm happy to. Before I do, though, I want to just comment that, Maggie, hearing your whole story, I realized that literally we have the exact same aims for our entire career, and we do cross over in some relevant experience, like Pepsi and other big companies that I had the chance to try to shift behaviors with and things, but that we've come at it from largely a different place, but boy, exactly the same aims. So yeah, I think I'm going to give you a quick sweep of this 50-year journey, because I realize that as of next year, I'll be 63. I know it's hard to imagine looking at me, but
it is actually.
So 50 years of literally, I started in a classical French cooking apprenticeship in a top restaurant at the age of 13, just before my 14th birthday. So that puts me a long journey here. And then I worked in French kitchens in France as well. And went on to own restaurants and open 2 schools for professional chefs in this country and in France. And then while teaching at a school called l'Académie de Cuisine, the school got a call from Time Life asking if there was a chef there that might be interested in launching a new series of books on healthy cooking. And this was 1984, before this nation was really cooking healthy. So it was kind of a novel idea. I took that call and ended up launching that series and co-authored 11 books there. And that kind of set me on a different course. So, that the first years were this deep culinary life. And I got really deep into kind of an understanding of the role that food plays in health and well-being beyond just the culinary world. I was sent around the country to do depth research when I was, 24, and I just saw how America eats, and it was different than the way I grew up. The only craft product or sort of big processed food product that I remember growing up with was Philadelphia cream cheese. Other than that, we didn't have a lot of stuff in the house like that. But from there, I left Time Life, and I was asked by at the time the world's largest food company, Kraft, to come and be their first executive chef, and then shortly thereafter, 6 months later, to launch and lead a group called New Concept Development. So I did early development across all the divisions there. We worked across the whole portfolio. I secretly was there to try to, impact Kraft's portfolio. Of course, the biggest food company in the world corrupted me as much as I tried to change it. But it was a fascinating experience, and we launched hundreds of products. And I created the quickest, the fastest product to $1 billion at Kraft. I'm the father of DiGiorno pizza while I was there, and so that was kind of my.
That's amazing, right?
Yeah. And then I hired a group in Boulder, Colorado called Sterling Rice Group to help us position it and name it, because it wasn't named DiGiorno, and we didn't have the tagline, "It's not delivery, it's DiGiorno," which really is what put it kind of on the map. And then I ended up spending a decade. I left Kraft and went to that company as managing partner in Boulder, leading innovation and strategy for really large food companies up and down every division of Pepsi, and even across the aisle for a little bit of Coke, but Kraft, and then all the large and small natural foods and organic foods brands all came through our doors. So it was kind of a fascinating time. I led health and wellness there, and we did depth research. And I was called upon by Meet Johnson, Weight Watchers, and Jenny Craig to go do depth research with people that were struggling a lot with weight. And it changed my life. I, went into people's homes that were carrying 30, 40, 50, sometimes 100 pounds more on their frame than was useful. And I saw, my gosh, we have a really significant problem here. So then I left to start a play company because I decided I'd forgotten how to play. So we studied play from cradle to grave, and that plays into the Monj story here as well, because I learned a great deal working with Dr. Jane McConigal at building a company called Super Better about the science of intrinsic motivation, how to actually guide people intrinsically as opposed to extrinsically. And that was the moment that Monj was born, where I thought, okay, let's apply this science to food and cooking in a way that intrinsically inspires people to do this. And so Monj was born to build competence and build confidence and build connection around food, around joyful food that just happens to be healthy. And we started as in the employer space, and we've grown from there. And we'll talk a lot more about it.
Adam, I've got to admit, whenever you started talking about the fastest growing or fastest product to get to $1 billion, I thought you were going to go Kraft macaroni and cheese, but that's just me. I mean, yeah, but I think DiGiorno's a much better story.
I'm old, but I'm not that old, Kevin. I think that was.
Oh, I know.
I was just going to say, I bet there was a time when we all lived on that.
Yeah, we did. Yeah.
Right. So Maggie, have you seen the food as medicine movement evolve over time? And why does it seem like that is having its moment right now?
So I will go back a little bit further than my involvement in it, just because I think sometimes because of the siloed nature of food and health, people don't think, don't realize that this has always been a thing, right? Food as medicine is an ancient concept. And anybody who's familiar with traditional Chinese medicine or Ayurveda understands that diet is really core to prevention and to healing. But it hasn't been the norm in our country or in our food or healthcare systems. And in large part, that's due to, industrialization and a time when scale and shelf life and cost were more critical than nutrition, right? Post-depression. And healthcare really shifted at that same time towards pharmaceutical and acute care. And that really resulted in this siloed, what we kind of have today, a trend that continues today. These two sectors are really siloed, despite a lot of the concerted efforts that, have been made over decades. And so, if you follow that trend, it's not surprising that there was then post-industrialization, this rise in rates of obesity, diabetes, and other heart disease and other diet-related chronic diseases, and an increased cost burden on payers and consumers. So there were then, this is, I don't know, around the 70s or so, when the food pyramid, right? So some large scale public health initiatives were launched and the food pyramid came into play. And there was really general guidance and at least an acknowledgement that there was a connection between food and health. But there wasn't real clinical guidance with that. And so, around that same time, there were some really dedicated and determined people running organizations like Wholesome Wave and Fair Food Network. And they were focused on two things, though. They were focused on health, but they were also focused on supporting local agriculture. And they saw in these fruit and vegetable incentive programs an opportunity to do both things, to support local agriculture and farmers, and also support the health outcomes of some of the most vulnerable populations. So they started to build these programs to double up SNAP bucks, right? And that's, I think, one of the programs that people are most familiar with. If they know anything about food as medicine, they kind of have heard of those incentive programs or produce prescription programs. And those people and those programs and the evidence base that they were able to start to build are really what was responsible for USDA building that large scale GusNet program into the SNAP program. And so around that same time, you have organizations like Community Servings and Mom's Meals, who invested a ton of time and resources into finding funding for and conducting research to prove out the business case for medically tailored meals, which was another thing that, if people are familiar with food as medicine, they usually know about those two things. So that's, the evidence base continues to grow there. And you start to see other like state governments, municipalities, and other payers like health systems funding pilots around the country. Food pharmacies popping up at hospitals, and the things that I think a lot of us would say that's when the real food as medicine movement started to become a thing. And that's kind of when I came into the space. And it was really about broadening the aperture from emergency feeding to food security, and then from food security to nutrition security. And that really there was this recognition that there's a relationship between poor quality food and diet related disease on such a bigger scale. And so a lot of these, early programs got funding, were able to tap into funding sources like Medicaid waiver programs and Medicare, and sometimes even commercial health plans for people coming out of hospital stays. And that's why there's a whole lot of research for and evidence for those two types of food as medicine interventions, and why those are often covered by payers where maybe some other food interventions are not. But that's starting to change. If you fast forward to today, advances in technology, the ability to reach patients and consumers where they are, whether that's the grocery store, home shopping, online, at work, to nudge behavior change and track outcomes and then integrate systems, has really changed the game and really sped up progress and innovation. And so you see retailers and employers getting into the game, and they have the opportunity to impact consumers where they shop and work, and that is really powerful.
Adam, it sounds like you had something to add to that.
No, I love what Maggie was sharing, and I think it's really not people's fault. Okay, if you spend enough time working with multinational food companies, you understand, and grocery stores, they're driven towards margin, and there ain't big margins in the big food companies, and there's even lower margins in grocery. And so they're going to put products on the end aisle displays that, they can make the biggest margin on, or that the companies that are selling them the products, the big, producers and manufacturers, make the most money on. And so, people can't quite help it, because I know all the tips and tricks that the multinationals use to create craveability. I know all of them, and so it's a challenging thing. But on the other hand, I agree with Maggie talking about the power of food and healing, and medically tailored meals is a great example of, of a main thrust in the food as medicine movement. But as we look to putting your hands on whole foods and actually healing from foods and cooking, it's very powerful in and of itself. And when we put our hands on whole foods, we don't have to get complex. We can keep it simple. It regulates our nervous system. It literally reduces inflammation from the inside out. It improves cognitive performance and reduces mental fog. But most importantly, self-expression and activating of positive emotions and a sense of connection with those around you. So it's really powerful. And that's why there's something called culinary therapy, which Maggie knows as well, because we've realized, wow, cooking in and of itself is a healing act. So, yeah.
Yeah, I was going to say we do a lot of that around our house. Yeah, I didn't know it was called culinary therapy, but
There's a term. There's a term.
Yeah, I think for me, and Maggie, you touched on this, the number of different media that consumers are absorbing now. I don't know if my social media has just had an intuition that I was going to be doing this interview or what, but I seem to have been inundated over the last couple of weeks with suggestions on what vegetables to eat and what order and protein, and like, holy cow, did you guys get into did y'all slide into my DMs?
Your phone is always listening.
Boy, no kidding. But then Adam, you touched on something else. I mean, a little bit broader than culinary therapy. I mean, food is community, food is entertainment. That is how we connect to people. And so what better way to improve everybody's health, not only as we're talking physical health, but their mental health as well.
Exactly. Yeah. We talk about nourishment and we think about it on the physical plane, but it's nourishing your emotional life, nourishing your social connections, nourishing your ability to care for others. It's very powerful. And yeah, so it's center in our lives for sure, for all of us. Yeah.
So, Adam, we talked a little bit about Monj, but talk a little bit more about what inspired the creation of Monj and what industry gaps or inefficiencies that it's addressing now.
That's a great question. Thanks. Yeah, you know, when I was at Kraft a long time ago, um, working with a woman who went on to become CEO, she was the head of the pizza division, so she and I were deep into DiGiorno for a while. She said, Adam, why don't we shift our discussion of craft products from absence of negatives to presence of positives? And this was a big idea, right? Because absence of negatives is taking fat out of cream cheese or mayonnaise and calling it light. Okay. But what we replace it with are what are called low water activity sugars that actually turn out to not be better than the fat, for you. So she was thinking, well, how do we actually introduce presence of positives? Well, whole foods are inherently presence of positives. You don't need to do anything. They're already loaded with prebiotic fiber, loaded with flavor, if you know how to cook with them. And they happen to be just not calorically dense, but they're incredibly nutrient dense and good for your gut. And so I was fascinated by having grown up in kitchens and written those 11 books on healthy food that America was gripped by this myth that many of us still live with today, that eating healthy requires sacrificing taste or sacrificing joy or satisfaction. And that's simply not true. And so I was ready to kind of put the nail in that coffin with Monj by showing people that you can have your cake and eat it too. You can have an incredibly joyful, abundant food life and actually improve your health dramatically. So that was that, along with the behavioral science I mentioned that I learned with the play company, is what kind of gave me that inspiration. And so yeah, so at a deeper level, I think if I step back, I don't think that we really have a weight or weight loss problem in this country. We don't really have, it's not about the weight. It's really about a behavioral operating system problem. We've lost our ability to kind of shift our behaviors or bring our behaviors back, rediscover the behaviors that our grandparents and great grandparents kind of had. So Monj is really about treating. It's not about treating the symptoms that kind of plague us in isolation, but really kind of addressing the whole human being. And I would also add that the team has heard this many times at Monj, but I don't think of Monj as a nutrition company. We get put into that category a lot, but it turns out people don't eat nutrition. I didn't tell me the last person that said, "Oh, I ate this great nutrition recently." So, so I think what we're really after is to create lasting metabolic health through cooking, through community, through food, and really shift the dialogue from a motivational engine, which it is only in short supply. We only stay motivated for short bursts of time extrinsically, into an inspiration engine, which is a wellspring. When we start to learn and gain autonomy and competence, and we get excited by what we're making, and then our family or our roommates say, "Oh my gosh, this was amazing," we want to do it more. And that's those little behaviors build and build and build. And before you know it, you've reclaimed your food life. So that's kind of the idea. The last thing I'll mention is kind of expanding on GLP-1s a little bit. They're possibly the most powerful metabolic drug we've ever seen. I mean, they're incredible. What started as diabetes and then weight loss is now, wow, it's going after root cause. It reduces inflammation. So it can fundamentally shift biology, and that's incredibly powerful. But, behavior determines whether those changes last, right? It's behaviors. So if we don't solve for behaviors, we're creating more dependency. We're creating these loops. So I think of rapid weight loss as kind of phase one, but rewiring, our behaviors in ways that are joyful and fun, not in ways that are punitive or compliant, if you will, which we never stick with. That's the game. So that's where Monj was born.
Very good. Well, Maggie, how were you introduced to Adam and Monj, and what really excites you about the platform?
Yeah. Yeah, I was thinking as Adam was talking that it was really, I think it really, I've done a lot of work in the last couple of years focused on this intersection or food as medicine for a GLP-1 world, really thinking about what's going to move the needle and what's going to help get employers over the hurdle. And I think that is a huge catalyst. And so, you know, my work in that space and my work with organizations like Hero and the Nourish movement have really allowed me the opportunity to meet and see so many of the greatest innovators and innovations in this space. And so I was doing a workshop at a conference, and a woman reached out to me and said, "Hey, I saw you're doing this workshop, and I'm representing this company. They're doing amazing work in this space, and I really want to make sure we connect at the conference." And so, and that was our friend Diane, who made the introduction. And I think it was clear when Adam and I met that we had a real synergy in not only our experience but kind of our reasons for being in the space. And I got a firsthand demonstration of Monj, and I was so impressed. I for two reasons, I'll say most primarily two reasons. One, in my long history in the space of food as medicine, health, kind of nutrition focused interventions, I know that one of the biggest hurdles to overcome, because for food to be medicine, people have to eat it, is really the human behavior piece. And so what I think Adam, he talked about how he kind of merged his worlds, but really Monj, what he's done with Monj has really done an amazing job of incorporating really complex behavioral science into simple and engaging messaging, games, and other nudges that help users follow through on their intentions to eat better, because most people want to eat better, and it's hard to do in the food environment that we live in. I'll just say that. And then the other thing that really excited me about Monj is the culinary therapy piece that Adam mentioned. I didn't say this in my earlier segment, but one of the most powerful interventions that I've seen in the food as medicine space is this idea of culinary medicine. It's also one that healthcare systems there have been some innovators in that space who figured out how to do the billing so that they can hold these classes for multiple people in certain community settings, hospitals and schools and other places. But culinary medicine, I have seen, examples of entire families losing hundreds of pounds, right? And communities being impacted by this work. And so the idea that you can, teach someone how to cook in a way that matches their cultural preferences, it tastes good, matches their cultural preferences, is simple and affordable. That's kind of all the components of culinary medicine, and also what Monj does so well. And I think the cooking demonstrations are amazing substitutions for in-person demos, because it really feels like you're there with the person. They do such a great job of engaging the user virtually. And so, especially for so many people around this country who can't get to an in-person event, it really does function a lot like a virtual culinary medicine platform. So I get excited when I see, this growing demand for tools out there among employers and other payers that will support people on their health journey, whether that's spurred by chronic disease, weight loss needs, or some combination. This is an amazing tool, and employers are starting to become more aware than ever before that nutrition can affect workforce health and performance. And that's really, in large part, thanks to some of the research done by Hero and others. So you can kind of see how these worlds are coming together. And that, for self-insured employers, especially, healthcare cost is a P&L issue. It's a bottom line issue. Chronic and diet-related diseases are a huge driver of that cost. And then GLP-1s are a huge catalyst. And they're, as Adam said, they're, for many people, they're a miracle and they're effective, but they're expensive and they're not a complete solution. So they've made metabolic health really visible at scale, and employers are realizing that, without a nutrition solution and behavior change, They're just managing costs. They're not solving the problem, and GLP-1s will continue to cost them money for some time to come. That's the cost is it may drop in some formats, but that's going to continue to be expensive. So I think, there's in addition to there being a huge opportunity for employers with tools like Monj, there's also a huge opportunity for retailers and those with pharmacies who are trying to provide additional value and stickiness for consumers and working to really bridge that gap from pharmacy to grocery. So lots of opportunity.
Very good. So Adam, how does Monj differentiate itself from other platforms? And what are the common pain points that your customers, whether it be employers or retail or whatever, what are they wanting Monj to solve?
Yeah, that's a good question. Well, by the way, that was great, Maggie. I think that really covers comprehensively the landscape and this perfect storm that we're facing. And I think I just wanted to comment that this is a moment where we're starting to connect the dots, if you will, between different kinds of programs, different kinds of providers, with a more of an aim towards the whole person and really understanding their life and social determinants and really connecting those dots. But for us, what kind of makes us different is that a lot of programs like ours that we've seen focus on collecting a lot of data, tracking, coaching. We have coaching as well, but where this intrinsic inspiration engine isn't about just knowing how many calories is in the apple per se, or following a lot of taking pictures of your food, which can be very helpful for people. But this is more about integrating kind of a full system or almost a curriculum for lasting change that is more, I think Maggie used the word, that nudges you, that guides you in small steps or big steps. Making dinner is a big step. We guide you through in a way where you're learning the hows and whys of what you're doing. So it's not a recipe. It's really like we've hacked cooking school and we've made it fun to actually smash garlic and chop an onion and do the prep. The prep is no longer a burden. You have fun with it. And then when you get to the stove, you're all ready to go. There's no stress because everything's prepped. And we teach you why you turn the oven up when you're going to roast something, or what a saute is and why you shouldn't overcrowd the pan. Otherwise you end up steaming. And people kind of love learning about the science of it, not just the practice. It's sort of science and practice of all of it. And that's kind of at the center of it. And it's culinary skill building, it's behavioral coaching wrapped around that, and rich social connection. I think that a lot of programs have a lot of information in them. At the center, as Maggie can attest to, this is so much about food. Now, everything in Monj I mentioned is already healthy. That's because it's based on the Mediterranean diet principles applied everywhere. Snacks, eating outside the home, eating at home, combined with some of Harvard's DASH diet, which is kind of a hypertension diet. We smash those things together and everything we put in there is already there, but we don't tell you that. We just focus on flavor because flavor is the secret weapon. People want big flavor and they want abundance on the plate. They don't want to feel like they're hungry. And as I mentioned before, we don't want to tell you you're eating a lot more plants, because a lot of people, particularly men, will say, "Ick, I don't want a lot more plants." You just have a lot more of that on your plate, but there's so much flavor wrapped around it. Again, not calorically dense, but so rich for your gut, so rich for your palate, and really exciting. All one pan, one meal, one whatever, no fancy equipment. So that's kind of what sets us apart.
Great. So for both of y'all, why is it so crucial that organizations should proactively look at this issue? And what are the potential financial and operational risks of inaction?
Yeah, sure. I mean, I think we touched on a lot of the reasons why. I mean, I think the metabolic health conditions that are on the rise and are obviously some of the largest drivers of employer healthcare costs, especially self-insured employers, and productivity loss among their employee population. Those are real, like, bottom line reasons why. And I think, and then add GLP-1 medications to the mix, and um, they've just accelerated the urgency, right? And so employers who don't implement a thoughtful strategy will face rapidly escalating pharmacy spend, higher long-term claims, reduced employee productivity, and lower retention. And those who proactively address it are, have that's a differentiator for them, right? Like employers are
Right.
competing with each other. And if they can find a way to balance out those losses by implementing innovative programs and that are engaging and have real value for their
Mhm.
employees, or for retailers, for their shoppers, they are really differentiating themselves, and they're going to increase retention and recruitment, for employers, and then for retailers, they can increase loyalty and stickiness for their shoppers. So
Yeah,
seems like a
I would
no-brainer to
agree.
me.
Especially at the low cost that we can kind of deliver this. Yeah, I think that's great, Maggie. I would only add that from a data point of view, obesity and other cardiometabolic conditions can increase annual medical spend on a per capita basis by 3 to 5 times. So it's really big. And then layer on GLP-1s and the demand for them, and the employers are really kind of are struggling a lot. But I think also I would mention, if we stepped back, okay, we are at a particularly challenging time on the planet where there's a lot going on. Okay, the rise of
Mhm.
technology, AI, wars, politics, the cost of food and gas, and people are feeling a lot of pressure. Okay, in the workplace and outside of the workplace. So we're getting dysregulated more. And when we get dysregulated, it turns out we tend to turn towards eating more comfort foods that tend to be, things from our childhood and sweets. And this is why a lot of people associate feeling that they have to sacrifice if they're going to eat healthy. It's because of those treats, whether it's a big pan of mac and cheese, or I'm going to, have Pop Tarts for breakfast again, whatever it might be. And it's all good. There aren't bad foods and good foods. There are some ingredients or things like trans fats that are inherently, we know, that are problematic. But I don't really believe in bad and good. It's about moderation. But we're just living in a moment where, if we can return to these rituals, these nourishing rituals that ground us at home, connect us to each other, and quiet down a little bit, this is what's actually going to lead to kind of sustaining us and helping us carry through. So that's kind of a broader statement, but I was just thinking the moment in time right now is really challenging, and we can go one way with our food life, or we can go another way. Let's go. Let's
Yeah,
take the
no, I would
right
agree,
path.
and I love the direction, or what you said about, you start with flavor, and then you work into nutrition. My family and I, we spent 2 weeks in Tuscany last year, and it was spectacular. We've been before, but this time we really slowed down. We really took advantage of the countryside, that whole eating and wine lifestyle, if you will. We had amazing food. Probably the best food I've ever eaten in my life. Fantastic wine, and I've got to admit, I ate as much and drank as much as I could. And when I got home, I'd lost weight because the food was so good. And I think one of the other things too, it was so flavorful, that and filling, but the portion sizes weren't what we have. I mean, they didn't have supersized pasta over there. They didn't have, triple triple paninis and everything else. And I think, but included in all of that was the sense of community and the sense of joy that we had during all of that. And we made our own meals a few times in our villa. And going to the grocery stores there in Tuscany, were it was just amazing because the colors, the wide array of vegetables and fruits and olives and everything was just amazing. That we just don't have that in a lot of places in this country.
Beautifully said. And we have more of it than we realize if we tune in, but we don't have that kind of rhythm. And I love what you shared. I get it intimately, having spent a lot of time, in Europe training and living life. And in fact, the inspiration of the word Monj is not just to eat, but it's about conviviality and connection around the table. It's about slowing down and moving into a rhythm that the Italians and the French seem to really understand. So we have some things to learn from them. Yeah.
Yeah, absolutely. So any final thoughts as we wrap up?
Sure. I mean, I guess I would say, gosh, we've talked about connection, and I would say that again, now more than ever before, there's an opportunity to connect these systems, retail, like employers and retailers. So I mentioned there's opportunities for each, but there's a real opportunity for employers to connect with retailers. As they're implementing food as medicine programs. This is, people often live and work in the same community and shop in the same community. So with platforms like Monj as the connector, whether standalone or bundled with other complementary programs, there's huge opportunities to connect employer funded subsidized programs with retail programs in a way there's never been before. And I think when you think about people who are armed with good intention, incentives, and then have the education and training and support that they need, um, they're set up for success. And that's really what excites me about this work that I get to do, and meeting people like Adam is, the systems have never been more ready to come together to support consumers than they are today. And so I'm a connector. That's what I do in my life and in my work. And so getting to help make those connections is really what gets me out of bed in the morning.
Yeah, no, I love what Maggie shared. And I'll just add that I love the idea of the ritual of going to the store, going around the perimeter of the store, which is where a lot of the fresh foods are, and recognizing that pharmacy is there as well for most people, so that we're kind of combining worlds and making connections between the foods we eat and the prescriptions that we need or take, and working more intimately in these networks where there's just a deep focus and care about health and community and well-being. And so I love that idea. So,
Well, thank you. Thanks to both of you for being on I Don't Care today. Anytime I can talk about food, I mean, it's fantastic. But you put such a healthy spin on it today that it's given me a lot of things to think about. So I appreciate that. So folks, I hope you've enjoyed today's episode with Adam Devito, the founder of Monj, and Maggie Biscarr, a subject matter expert in the food as medicine space. And think a little bit more about what you're eating. Don't sacrifice flavor, but be a little bit more intentional about your diet. And I think you'll be better off for it. So with that, I'm Kevin Stevenson. Thanks for joining me today on I Don't Care, and we'll see you next week. Take care.